Good day everyone, my name is Ra'a Amir from King Saud bin Abdulaziz University for Health Sciences, and I'm going to perform today and demonstrate how to perform breast examination. So first of all, you have to greet the patient, introduce yourself, confirm the patient ID and age, gain the consent of the patient after explaining the procedure, and you can also indicate the presence of the chaperone if needed, if you are a male student or a male doctor. After that, you will wash your hand. Okay, and then inspect the general appearance of the patient, if she looks ill, if she looks cachectic, anorexic, or any other abnormalities in the general look of the patient, if there is any IV lines or any other things. After that, you will get a close look into the breast. So you will inspect the breast, both breasts for the size and the symmetry of both of them. Then you will check for any incisional scars, sternal or under the any incisional scars under the breast. After that, you will also check for any abnormalities in the skin. You will check for any inflammatory signs. As you can see in here, you have the dimpling sign, which is mainly could be a malignant sign. You have the pida orange appearance, or the orange peel skin appearance. You check for the areola for any skin abnormality or any inflammatory changes. You can see here some nipple retraction. In the other breast, you can see in the skin, you can have some red spots in it. You see in the areola area, you can see some skin changes and some inflammatory changes. As you can see here, we have the ulceration. Then in the palpation, you can check if there is any discharge. Okay. After that, you can also indicate for the patient to do it in different positions. So putting the patient in a position, her hand beside her trunk, or putting her hands against her waist to contract the pectoralis muscle, or her hands above her head. Okay. After that, you will inspect the same thing again in different positions. After that, you will go for the palpation, doing the breast into 4 quadrants with the central area containing the areola and the nipple. You will start from the lower part, okay, in here, with 3 different pressures from the palmar surface of the 3 middle fingers. So you will start from the middle side, from the lower side, from here, okay, 6 o'clock clockwise in the superficial pressure first, okay, like this. You're checking for any lumps, okay, and then you will go for the intermediate pressure, 6 o'clock also, going clockwise, okay. You check with the deep palpation for any lumps also. And don't forget to palpate or to squeeze the nipple to check for any discharge. Okay, so in here I can find the lump. It's mainly 2 centimeters in size, irregular surface. Okay, and you check also if it is mobile or not. So I don't think it is mobile. It is more affixed to the chest wall. Okay, and we said it is firm and irregular surface. Okay, you also check the other side of the breast with the same technique, and don't forget in here, because you have inflammatory changes, you will press and check for any discharge in here. Now, if the patient tells you if there is any pain, you usually begin from the normal breast before the breast that contains the pain. Okay, and then we will go to checking, inspecting, and palpating if there is any lymphadenopathy. So after palpation, you move on to inspect for any lymphadenopathy. So you check for giving the patient a position sitting toward you. So you will check for any obvious lymphadenopathy in the supraclavicular area, infraclavicular area, and checking for any signs of lymphadenopathy in the axillary lymph nodes. Okay, so you always compare both sides, and then you go for the palpation. You palpate the supraclavicular area to check for any lymphadenopathy, infraclavicular area, okay, and then you will go for the axillary area. Don't forget to wear your gloves and wash your hands. So wearing the gloves, And then you will check and palpate the axillary area, the anterior, the posterior, and the lateral lymph nodes and the medial. Okay, so you will support the weight of the patient's arm on your arm, so left with left, and getting your right arm into the axilla of the patient, checking for the lymphadenopathy. So you will check for the medial, anterior, posterior, and lateral lymph nodes for any signs of lymphadenopathy, which can indicate metastasis of the breast cancer. Other things you might do, you will check also the spinal processes of the patient to check for any pain, which is an indication of the bone metastasis. You will also check for and auscultate for any pleural effusion in the sides of the lungs. You also can do some abdominal examination to check for any liver enlargement or any liver nodules as a sign of metastasis too. So after you are done with your examination, you thank the patient and help them to get dressed, and ask them if they have any questions or concerns they would like to ask you about. And after this, you should mention some few points about the breast lump. So if you suspect any breast lump in a patient less than 35-year-old, you should do an ultrasound. If the patient is more than 35-year-old, you can do a mammography. You can also if you suspect any lump, as we found in this examination, you can take a biopsy from the lump, doing an FNA or core biopsy to determine the histology and the stage and the grade of the breast cancer. You should also educate the patient to how to do and when to do the breast self-examination. You should also take more history and about the symptoms of the patient, if she has any neurological symptoms, any other symptoms and risk factor that may suggest breast cancer or its metastasis. Thank you.